Good morning, everybody. This is Dr. Marc DuPéré, plastic surgeon at the Visage clinic here in Toronto, Canada. I want to thank my patient today for allowing us to film and post this video. Today we're talking about lipedema in Canada. Lipedema is a condition that's relatively common, actually, that's still a bit unknown in the medical field. It is a genetic condition where there is a disproportionate amount of fat accumulation in the lower extremities versus the upper bodies. They will often present with tiny waists, tiny shoulder frames, and they will have this larger thigh, larger knee, larger calf, larger ankles. They tend to have pockets of fat behind, but also multiple pockets of fat above the knee. And this is, to me, and also, they call it a cankle when there is no more ankle definition. And as you know, it's very important in ladies to have a nice ankle. They like to wear high heel shoes, skirts, shorts. Those ankles are very important in the ladies' femininity. So this leg has been done on the back only. I will turn her in a few minutes. This is 1,800, so 1,800 milliliters of fat removed from 3 sides of her lower leg. You can see the difference between the two legs. Big difference in circumference end result. I will turn her and I will complete on the other side after I'm done with the back. I do like to prone our patient. Proning means we put our patient on the tummy. It does require a team effort to turn our patients, but I flip most of my patients every week. So it's easier to get our results, better results. Now, lipedema is a somewhat meticulous and complex procedure, especially when we talk about the lower legs. When we do liposuction, when we're in plastic surgery school, we're told which areas we can liposuction and which areas we cannot. The ones we normally liposuctions often have 2 layers of fat separated by a fascia called the scarpa's fascia. So we always try to go in the deeper layer. There's lesser chance of lumps and bumps and surface irregularities. Now the lower leg is always an area that we were told in plastic surgery school not to touch. Now, I've done lower legs for 20 years. Did not always know this was called lipedema, but I knew this had to be done meticulously. So today, lower leg is a very common, it's usually the first spot that we start on a patient with lipedema. I do spend a lot of time, smaller cannula, to do a job very well here, because it's important not to have to come back to that area for many years. In Canada, for ambulatory out of hospital day surgery patients, we have a 5-liter maximal for safety purposes. So I do reach my 5 liters in my lipedema patient. It's a conversation I have with my patient. Most of the time I recommend to spend as much as possible on the lower leg so we don't have to go back there in 6 months or so. So I will remove probably 2,000, 2,200 per lower leg in her case. And the balance, which will be small, will be completed in the front. Her and I talked about the inner knee and the lower part of the anterior thigh. That's what we decided together. I carefully monitor the amount of fat that we remove, again, to make sure we do not go over the 5-liter margin. Lipedema is a condition, it's a genetic condition. When patients come to my clinic, there's always a family history of this. Mom, sister, grandma, and aunt. It doesn't mean everybody gets it, but it is transmitted genetically. They are working on identifying a gene in England and Germany and Switzerland where lipedema has been known for a long time. Now, before I finish this video, I want to talk about equalization. Equalization is extremely important for all liposuction procedure, but more so on anatomical areas where we have only 1 layer of fat. So when we're in plastic surgery school, we're told some areas can be liposuctioned and some others cannot. And it has to do with parts of the bodies where the layers of fat are divided in two by a fascia called the Scarpa's fascia. Now, when we go in the deeper layer of fat, when we have two layers, it's less likely that we're going to get little lumps and bumps and surface irregularities. The lower leg is an area that has only one layer of fat. So it's a little bit more likely to get little surface irregularities, lumps and bumps, sometimes tracts from the liposuction. That's why most plastic surgeons will not address the lower leg. Most plastic surgeons, most anesthesiologists are not comfortable flipping patients for a variety of reasons. But here at Visage Clinic, we've perfected the art of proning our patients. We've done this for probably 15 years now, where the whole team flip our patient carefully and safely. Now, equalization is a